what would the overhaul cost you?
Healthcare expert Seth Denson says part of the plan could bankrupt healthcare systems. He explains next.
Welcome back. Is Bidencare the new Obamacare? The former vice president's rebranded plan has left voters with more questions than answers.
What I'm going to do is pass Obamacare with a public option. It'll become Bidencare. Not one single person with private insurance would lose their insurance under my plan. So what we're going to do is going to cost some money. It's going to cost over $750 billion over 10 years to do it.
So you heard Joe Biden there. Who is going to pay for this? Here to break it all down, healthcare expert and business analyst Seth Denson. It all comes down to the money, Seth. Where's it coming from?
I don't know. And I don't think the Biden camp really knows either. Even in some of the early data that they put out, they're about $500 billion short of getting to the actual number. And I've said this a number of times. People lie. Numbers don't. If you're going to roll out an expensive system like healthcare public option for anyone that wants it, you have to do the math right, and the math just doesn't add up.
Putting the money aside for a moment, what are the main points the American people need to know about Bidencare?
Well, I think there are certainly some things that we can all get behind that's in what he's rolled out. Matter of fact, the Trump administration has said that they're going to do a lot of the same things like surprise billing. This is the practice where someone can go and have health insurance and think they're in network and get billed months later for thousands of dollars. Biden has also proposed that we do things like allow the federal government to negotiate drugs directly with manufacturers under Medicare Part D. The federal government is the largest procurer of drugs. They should be able to negotiate. So I'm in favor of that. So there are some other things like allowing consumers to buy drugs from foreign markets that have been approved. All these things are positive, but there are certainly some negatives in there. And some of those negatives all are surrounding massive inflation of spending. We have a health insurance problem in the United States, but we also have a health care problem in the United States. And when you squeeze the balloon without letting any air out, the money just gets moved around. We must address the driving cost of health care, which increases the cost of health insurance.
You mentioned money. Take a look at these numbers. Our research shows $800 billion is the total cost of a public option over 10 years. What is this going to do to our balance sheet?
Well, our balance sheet is already headed in the wrong direction. And many analysts project that by 2050, the United States, without any more spending, will be almost 200% of our GDP. That's annual GDP across the country, not just federal spending. So this is just going to add to that significantly unless we do the opposite. We roll out something like this and we do massive tax hikes. I'm talking significant tax hikes, not just to the top 1% or the top wage earners and corporations, but this is going to trickle its way throughout the entire populace.
Other questions? What will this do if I have private insurance and I want to keep it? We just showed a stat. 20% of private insurance plans could be gone by 2028 under this plan. You raised the key point, Seth, and we thank you for your time. Health care versus health insurance, that has to be the focus, and it never seems like it truly is. Seth Denson, we appreciate your time. Thank you, sir.
Thanks, Todd.